This is a Hope 1032 podcast.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&C Saatchi advertising creative, who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday. Dr. Amelia, today we're going to talk about female autism at 40 plus.
Yeah.
Which is a really interesting topic, very specialised.
It's very now.
It is very now. And I want to know, this whole autism and being on the spectrum thing seems to get bandied around a lot. And I have a feeling that people like me don't really understand what it is. But what I do want to know, what you think about this, is are we all on this spectrum thing that we talk about?
I don't think so, but I'll tell you what, I'm not an expert in this area either, so I think we should ask someone else.
Oh, we're going to dive straight into it. Well,
we should.
Before we do that, I did do a little research about this because according to Aspect, the Autism Spectrum Australia, at least 1 in 40 Aussies are on the autism spectrum. But perhaps we tend to think about autism mainly in kids.
Yeah.
I think.
I think we do.
Of course, it's probably a lifelong thing, right? If you have autism, it would be like lifelong. It's not.
Yeah.
I guess that's one of the things we're going to find out is can you actually overcome it or cure it, I suppose, or. But I guess it is possible to be only diagnosed later in life for a lot of people.
Yeah.
So today we're talking to the fabulous Dr. Terry Lim, who's a psychiatrist with the Mindsight Clinic. Welcome, Terry, to She Wasn't Born Yesterday.
Hello.
Hi, Janet. Hi, Amelia. Thank you so much for having me on.
Yeah, we're absolutely thrilled.
We are delighted.
You are an expert, and one of the many things you do is diagnose and help treat people with autism.
That's right. It's a growing part of my practice, I've got to say, especially in the last 5 years, I'd say. It's almost exponentially increased. That question of, am I on the autism spectrum has become
is that
really
right?
common.
Actually, can I stop you right there? Well, not that I don't agree with anything you've said, but why do you think it has become, and I agree with you as a doctor, like, oh my goodness, like this is being diagnosed more, it's been asked about more, my clients come in and ask me about it. Why do you think that's happened?
Look, I think we're living in this information age, and in the last probably 5 to 10 years, I think the people's access to information has just exploded. Now, not all of that information is good information, unfortunately, and I think we'll touch on that later on.
You mean Reddit? Reddit isn't a reliable source?
Well, I'd probably say TikTok is even worse than Reddit, but but it's about people being exposed to information. Now, in general, that's a good thing. I think the more information, the better, because it breaks down ignorance, and ignorance is the foundation of stigma. And if we can break down stigma, then more people get help, and more people will live the life that they were, that they were born to live. And I think the problem that we're facing, though, is that it's very easy to diagnose oneself these days. There are an abundance of checklists you can do, and it'll show you are on the autism spectrum. And the problem is that people don't really know what that means for them.
People like me.
Yeah.
Exactly.
Yeah, and I mean, that it's really common. And frankly, the other problem is that a lot of doctors don't know what it means for people either, and psychologists. And
that's not very reassuring.
Yeah, no, it's not. I mean, education in the professional space is really lacking, which is a real worry. And I think the thing that leads to is a lot of confusion. And I hope that we can clear up some of that confusion.
Yeah.
That'd be awesome.
Yeah, that would be good. One word I want to put in about doctors at this point is it's a new thing. So, okay, we'll excuse ourselves a little bit. But also, most of the doctors I know are autistic. They're on the spectrum. I
Themselves.
reckon they're highly, highly intelligent and capable, but they're often quite autistic. Anyway, that's just an aside.
Well, we know someone they should go and see. So after this, we'll give some details. But I guess first off, Terry, what actually is autism and how might we know if we actually have it?
That's a great question. Look, on one hand, it's a really simple answer, right? Autism is a condition, it's been defined. On the internet, you can find a really easy definition of autism. But I think the question is actually much more complex than that, unfortunately. And autism is a bit like most other mental health conditions. It's often seen as that you either have it or you don't. But actually, the more complex answer to what is autism is what aspects of you might be seen as autistic.
Right.
And what does it actually mean for you? So, there's a debate around, and again, a relatively fresh debate around whether autism is actually a mental illness or a condition or just a variant of the normal population. I think we could all see autistic traits in ourselves and in other people. And
Sure.
And it's very easy to go, well, you're definitely on the spectrum. And it can become a really easy way to explain a lot of behaviors. It's also a very simplistic way. So how we encapsulate autism has changed a lot over the years. Probably 20 or 30 years ago, we used to have autism, and then we used to have this thing called Asperger's, which are kind of like, people who we think are a little bit odd and, who maybe all work at Google or somewhere like that. And then there are people who have really profound disabilities. These days, though, we've broadened that definition and we've gotten rid of that term Asperger's. And now we talk about this spectrum of presentations. Now, the problem with the spectrum is that you can have everything from severe to not very severe. And the question is, where's that cutoff for a diagnosis? And what does that diagnosis mean? So there's also this concept that's emerged over the past maybe 5 to 10 years as well of neurodivergence. That's really driven from people who believe that they're on the autism spectrum, but feel like it's not enough for them to be labeled, as it were. And so I think this is really empowering for a lot of people who are on the spectrum is I think they've taken back that label and described themselves as just a different, which is what the term means. People who are neurodivergent have differences in the way their brains work compared to other people. And that makes it challenging for them to navigate the world around us.
Yeah, it's interesting because I read a quote recently where someone said probably the most important part of recognising neurodivergence in adults is feeling like you have permission to forgive yourself for your idiosyncrasies.
Sure.
And I thought that was a really powerful statement because I imagine that if you've been living undiagnosed and just have these differences that you feel like you're an alien in a strange land and everyone's treating you like you're very, very odd.
That feeling that people have is they just don't get it.
Yeah.
I just don't get it.
Yeah.
Yeah.
Yeah, I think I really like that quote because I think it's a very self-compassionate quote. And it also allows oneself to really examine, what are your strengths and weaknesses? And I think that's the aim. That's what I tend to try and go for when I talk to people about whether they're on the spectrum or not.
Yeah. What would the differences be from one end of the spectrum to the extreme end?
Yeah, again, really good question. There's been a lot of debate around whether the concept of autism is actually scientifically robust because it's such a broad range of presentation, everything from neurodivergence to people who are so disabled that they need a lot of support. But I think if you distill it down, there's really two sort of categories of features for people who kind of tie this sort of spectrum together. And those two features are really what I call core features, and they really explain a lot of kind of secondary features that people have. And the first one is really social difficulties. So in what we call social reciprocity, it's a bit of a tongue twister, but it basically means the way that we interact with other people, is it intuitive or is it really hard work, basically? Again, that's a very vague sort of description. A lot of people find social interactions hard work. You could be just...
Exactly. They could just be introverted. Yeah.
Exactly.
Yeah.
That's right. But I think it's a bit more than just what people really exhaust me. People on the spectrum do get exhausted by social interaction, but not necessarily because they're introverted. I've met lots of extroverted autistic people. I think that the difference is that there are some brain differences that make it hard for people on the spectrum to engage in what we call theory of mind. So theory of mind is the ability to kind of like go, I think that person's thinking this, And so I'm going to respond because I think they're sort of going down this track and they're feeling this. And it would be appropriate for me to maybe to dip it right now and have a listen, or maybe, you know, try and understand a bit more of what that person's saying. So these are very, very subtle social cues that people on the spectrum really struggle to pick up. They can often learn over time to pick up those cues, but it's really hard work. And it comes with a lot of trial and error and a lot of making mistakes and a lot of pain along the way. And so someone described it as a bit like people on the spectrum have a bit of a filing cabinet of favorite responses. And when they sort of get something from someone else, they kind of search through that kind of, filing cabinet and pull out the appropriate response. And so it feels a bit mechanical and it's a really hard work.
And exhausting. It sounds exhausting.
That's right. And
actually, that's really interesting because someone in our family has been diagnosed with autism, but I had actually noticed before I found that out that he did have this kind of stock standard responses and they were always the same. He would sort of run through them like in a conversation and you'd get these 3 or 4 stock standard responses. And wow, that's really interesting.
Yeah, so obviously he's discovered a way of kind of managing that, managing social interactions, but it doesn't take much for people to get found out in a sense. And of course, there's a ton of anxiety that goes along with that. So of course, people on the spectrum tend to avoid. One of the questions I ask people on the spectrum, I'm trying to figure this out, is you got a choice of whatever you want to do on your birthday, what would you do? People on the spectrum usually go, I just want to be by myself and do my thing.
Wow.
Someone else might say, well, I'm going to gather 10 of my best friends together and I'm probably not on the spectrum.
Really?
Yeah.
The second thing was what I call rigidity. So rigidity isn't just kind of like, you're not flexible and you can't touch your toes. It's more of what I call cognitive rigidity, right? So the way that your brain works is very, like a wire, it's very fixed. It's not very flexible, right? And flexibility is about how we adapt to the world around us, how we adapt to other people, how we adapt to changing circumstances and that kind of thing. So you might have heard of other features that people on the spectrum like describe, but things like sensory sensitivity, not liking a broad range of foods, having difficulty when plans change at the last minute.
Having to wear earphones.
Having to wear earphones, to concentrate. Maybe, once I get on this thing that I really enjoy, we'll forget about talking to me for the next 3 hours because, I'm going to be lost in this world. So, and really, flexibility or lack of flexibility is the other thing that I think defines that kind of autistic spectrum. And on top of that, you can have other things like whether you have an intellectual disability, they can kind of come along with that and things like that. And that really determines the severity of the disability.
Right.
So you can get other things coupled with it.
That's right. And I think this is where a lot of people struggle in understanding mental health conditions. And so they might come to a psychiatrist and go, well, do I have autism? Do I have this? Do I have that? And they kind of look at mental health like a still life picture, right? If you've been to the museum, you might see a still life. It's all perfect. It's exactly what the vase is. You know exactly what the fruit is. But I tend to look at mental health conditions more like a Pro Heart painting, if you remember Pro Heart.
Yes.
So autism is very rarely seen in isolation. There's often other problems that have come along, even in kids. They might have, ADHD or specific learning disorders, depression, anxiety, all sorts of things.
Yes.
Trauma is really common as well. So, I think it's really challenging to just talk about autism.
And it's not probably going to be as neat as people are hoping it's going to be. I think people probably desire to find out now because they think that's great. That's going to be an answer. In fact, you could almost be diagnosed as being autistic just because you want to know that you're autistic and you go, great, okay, that's what I am.
Yeah.
That makes sense in my whole life, but actually it's not that simple.
Yeah, that's right. This is sort of a phenomenon of confirmation bias, that we then you look for the things that we think are going to, confirm what we think about ourselves.
Right.
But I mean, on one hand, it's good because, it showed that conditions like this are becoming more accepted. I think 10 years ago, people were sort of clamoring to have a diagnosis of autism, but now it's something that people accept. So in some ways, it's not a bad thing.
Sort of on trend.
Which is great for autism in general, that people don't write you off as soon as you mention the word. But it is a strange time to be living in where people are going, actually, I kind of want to be diagnosed as being autistic and
But we're not all on that spectrum, is that right? So you guys are saying like you're on that spectrum or you're not on it.
Well, some people aren't.
Yeah.
Yes, some people aren't.
Right.
Terry said that very nicely before.
Yeah, right.
Like 1 in 40, I think you said. Am I getting it right?
Well, actually, I might just clarify that, actually. So I think that the problem with our thinking is it's very categorical. It's very much you're on it or you're off it.
Right.
I mean, it's almost like, well, everybody's on the spectrum because it's a spectrum, right? And so if you kind of see it as a variant of normal, as I said, all of us have kind of, times when we're a little bit different from other people or we don't fit in certain spaces. Some of it communicate better than others in certain situations. So I guess it's, the perennial kind of debate is where does that threshold happen where you can diagnose people as being on the spectrum? I guess that what we do is we build a picture for people. We build a picture of their personality, their strengths and weaknesses, how they respond to the world, what underlying the problems that they've come with. So when someone says, what's my diagnosis? My response is usually, well, what is it they have difficulties with? Which is more important to me than the diagnosis.
And maybe I'm just thinking that one of the other things is that language is very important. And so us being humans, as we do, especially in Australia, we shorten everything. And so everyone says, are you on the spectrum? Instead of saying, have you got features of being on the autistic spectrum? Like there are many spectri.
Yes.
I don't know what what the plural is of spectrum. We tend to shorthand everything.
I think that the culture that we're living in, especially in a modern, fast-paced capitalist society, it rewards a very specific type of endeavor. And so people with any differences can struggle in those endeavors. So, for example, you're creative. Does that mean that you're autistic just because you don't fit in many sort of, of the usual circle? So, our schooling system is a classic example of that, and our university system. But in an ideal world, we'd create multiple spaces for all sorts of people with all sorts of strengths and weaknesses. But unfortunately, the world doesn't work that way. So I think that's where people struggle and they're searching for answers.
Why would we only be diagnosed later in life, perhaps, than as a child? Is this just because things have moved on so much, like you were saying?
I think the fact that people are even being diagnosed later in life is a big shift. So I think that's been, again, something new in the last 5 to 10 years that I've noticed. Autism was by far and away a childhood diagnosis and really only for those who are really obvious, usually boys.
Yes.
And so the 1 in 40 is probably, again, it's a very black and white number, 1 in 40. It's probably more than that, really, if you think about it.
Right.
And so how do people get diagnosed later in life? Well, they kind of, I guess, the most common is that their children get diagnosed and they think, well, I was exactly like that.
Okay.
So that reflects also that we're picking up more kids as well, especially girls.
Yeah.
We are learning a lot more about how women on the spectrum have different difficulties. People say they present differently, but I prefer to talk about it as what the difficulties are to them as opposed to men. I think the core features are still the same, but I think a lot of the difficulties that women face versus men are really cultural and socially engineered. So, for example, men can leverage some autistic traits by getting to the workforce early, making a ton of money because most of them are in sort of white-collar kind of type jobs that are very technical.
Or IT. They're good in IT. Anyway,
engineering, astrophysics, building electric car companies, et cetera, that kind of thing. And so for women, though, are seen as, still as the kind of social lubricants of society. Whether you have difficulties or not, the fact that you're female, I think the expectation is that you're going to be great socially, and in fact, many men rely on their neurotypical female partners to kind of carry that.
Yes.
But then they may also be partnered with a neurodiverse woman who then also struggles to carry that burden as well. And so, of course, the pressure, though, will always lie on the woman. That's changing a little bit. I mean, obviously more females getting to the workforce, that kind of thing. And, I have a lot of female patients who are in the science field. But I think it's still in our Western society, women still carry that expectation of the social burden, I suppose, of society quite unfairly.
And they kind of do go under the radar as children because everyone's just kind of assumed that the strange, quiet girl in the corner, well, that's normal for girls.
So the reason for why there are more boys diagnosed than girls is a complex question again. Some of it is kind of social cultural, but there are also genetic factors as well. So we think that boys do carry a preponderance of autism gene or vulnerability gene.
Yeah.
But also boys tend to externalize their difficulties a lot more. So they'll tend to be more anxious, they'll display that a bit more, maybe a bit more aggressive, whereas girls tend to internalize their problems. So they might withdraw. They might get more depressed and anxious.
Yes.
And also their interests tend to be a little bit more in the social sphere. So, you might find girls who are really into the latest fantasy novel, which most parents be stoked at it. My child is reading, 100 fantasy novels a year, but the little boy might be into, I don't know, pulling apart things. So he's pulled apart the toaster, he's pulled apart the computer, he's pulled apart drives the parents crazy.
Wow. And how do you actually diagnose it when someone comes to you with their child or themselves?
So certainly how we diagnose is different from age group because of the context. So obviously for younger people, school and education is the major context. And then I get family life after that. But for the adult, especially the adult in midlife, that's a really, really interesting question. The universal experience that when we hit midlife, stuff's going to happen, whether you want to or not. And you're going to end up asking questions about yourself. And all those things that you just put up with, you're going to go, well, do I have to put up with it anymore? And if I don't, well, I need to understand it. So what people usually present with is, yes, that question, am I on the autism spectrum, or do I have this or do I have that? But actually what they're asking me is, why do I have these difficulties? Why have I struggled in my work? Why have I struggled in my relationships? Why am I always depressed? Why am I anxious, all the time? That kind of thing. And to answer that question is a much broader question. That might be to do with how one was brought up, what trauma one faced in childhood, what were their educational opportunities in life. The list of factors that determine your difficulties at 40 plus is endless. And so what as psychiatrists we do is we tend to build a picture, as I mentioned before. We build a picture of one's strengths and weaknesses, what one's personality traits are and preferences, one's past and current sort of circumstances, relationship problems. Sometimes the person that stands in front of me or sits in front of me really isn't the problem. It might be the spouse or it might be, people at work. And sometimes telling people, actually, there's not a lot wrong with you, but there's a lot wrong with people around you can be very empowering and quite eye-opening.
Right.
And that happens right uncommonly.
Yeah.
I was telling Janet earlier that because I do relationship therapy a lot, so I see a lot of people who are 40 plus who come in with relationship issues. That it kind of falls into two categories. Like some people are diagnosed as being autistic, and it's kind of fabulous for the relationship because there are so many answers, or the other person in the relationship even goes, of course, because, they're struggling with that kind of thing. It all makes sense to me. But then also you get the people who've been diagnosed and kind of really dine out and they kind of, like, it excuses every single irritating thing they do in the relationship.
It's okay, right. I've got autism.
Yeah, that's right. Look, I think that's a really great point. A diagnosis can be quite beneficial. It can really be a real problem. It introduces a new variable into the mix. And I think if people aren't supported by good professionals, a diagnosis like that is meant to be the start of a growth process. And I always tell people who I do diagnose on the spectrum, this is just the beginning for you. This is not the end. This is now a chance for you to kind of accept parts of yourself that you found, challenging, to work on your weaknesses, right? And to maximize your strengths. So that might mean, for example, considering a new career or relating to people in a different way, or, getting some training in how to respond to people. Yes, it's going to be hard work. Give yourself a rest, be kind to yourself, but don't give up working on it.
Yeah.
So how do these things help? Do they actually help end the autism, or does it just help you to manage it and live with it?
Yeah, it's a bit like, can you end your personality traits? And so the answer is no. I mean, really it's about acceptance. If one finds a diagnosis helpful in accepting and understanding oneself, then that's helpful. But if it becomes something that adds to one's sense of, defectiveness, or if there's something wrong with me, then that's not helpful at all. And unfortunately, it's hard for the average person, in the community to determine how to use that information. I'd sort of talk about more like understanding, accepting, and then trying to grow from the whole thing.
So how would you grow?
Yeah, that's a great question. I really believe that everyone has the capacity to grow. Otherwise, I wouldn't be in this job. A lot of psychiatry is about just dishing out medication. But one thing I love about my work is that the people that I see, as I said, all of them have the capacity to grow. And I think it's more about helping them to understand themselves and accept those parts of themselves that they can grow in. Now, you can't grow in everything, especially overnight. So it's helping people to take a long-term view of this whole thing. And that will involve, helping their partners understand what's going on, helping their families understand what's going on, maybe supporting them in the workplace and, the question these days is, should I tell my workplace that I'm autistic or I've got ADHD or whatever it is? And that's a really difficult question to answer, because some workplaces will be great and others will be terrible with that information. So, but all of these things are really different landmarks along the journey of growth, you know. How do I navigate my workplace? Could I change careers? You know, these are all, I think, exciting possibilities for most people.
And what sort of tools do you give people to help them with this growth?
Yeah, like it's pretty practical, to be honest. But I also tend not to stop with one diagnosis. You know, I often encourage people to think about their personality styles. Yeah. Not a lot of psychiatrists say this, but I really love the whole kind of personality typing thing, because it's another dimension of understanding oneself. Again, not set in stone, but it can be a kind of fun place to start.
Sounds good.
I was going to say, basically what Terry is also kind of saying is that knowledge is power.
Ah, yes.
That's right. Knowledge is power. And I think if you can understand yourself in as deep a way as you can, I think that gives one the power to improve. So what other tools? Well, I think if there are specific, mental health conditions to treat, obviously treat those. Seeing a psychologist would be a really great idea as well for most people, especially people, a psychologist that knows a bit about autism. And as I said, while we don't necessarily treat autism, usually a lot of other things that we can treat, anxiety, depression, things like a learning disorder, ADHD, we can treat those things. Sometimes the response may not be as good because of that underlying autism sort of type of characteristics. But again, if we can help people to kind of accept those parts of themselves, then often actually people just feel better. So it all starts from that sense of self-understanding.
Actually, I was going to say, it really is an interesting kind of thing with autism, that one of the treatments for autism is almost treating society, like getting society to realise that it's relatively common and they can cope. Like, it's not going to ruin anything if someone within your company or sphere has autism. But so it's kind of like treating society so that the people with autism actually are living their better lives.
Yeah, absolutely. One of the things that people on the spectrum, when they do get this information, is that if they go on a quest to find their tribe, their people, and it's great when they do, because they realize they're not alone. There are other people just like them. And if they can put up with the rest of the neurotypical world for a little bit, then they can decompress with their crew, which is great. And a lot of young people are finding that, especially. I'm finding a lot of young people, especially in the late adolescence, are coming across this information and driving things like a diagnosis or an assessment.
Actually, I'm just thinking about our, demographic, theoretically listening to this. I'm sure there are younger people and male people and older people listening as well. But actually, for women 40 plus who do, decide to look into this and get diagnosed, it sounds like it could be quite relaxing for them. Like they could actually find places where they go, I don't have women competing with me or asking me to compete with them, or like actually I can find people who are genuinely my friend where I can relax.
That acceptance thing, isn't it?
Yeah.
Forgiving yourself and...
Absolutely. And look, certainly, as I mentioned before, 40 plus is a real time of change for a lot of women. There are a lot of hormonal changes. There are a lot of family changes. Kids grow up and they leave the home, and maybe they're looking at their marriage going, well, time for a review, I don't know. But often it's just about...
That's very polite.
Yes, but often it's about also asking themselves, what do I want in life? I think that's a big question that hits a lot of women in their 40s. And it doesn't necessarily have to be a review of everything, but it's just about allowing oneself to look after oneself, to meet one's needs, to put oneself first. After putting everyone else first, in their life. So,
good heavens, putting oneself first.
This is the key.
What
isn't
a
it?
thought.
I think everyone should go and see you anyway.
Yeah,
Terry,
exactly.
Regardless of whether we think we have autism or not, just to get that validation.
Good point. I think whether you're on the spectrum or not, I think it's as I said, it's a really universal experience. But for women who are asking themselves, how can I grow? And I think that's where things like getting an assessment from psychiatrist, psychologist, or someone like that. Someone sensible. I have a patient who came saying, I think I'm on the spectrum. One of the easiest people I ever had to talk to, but pretty much said, I don't think you are. But she came because, unfortunately, her GP said, well, I'm on the spectrum. I've got ADHD and I think you do too.
Oh, really?
Yeah. And so, again, as long as people are open-minded and are willing to go on an exploration journey, I can work with them. If they become fixed with this idea, then I can't work with them, because they've decided that's the answer to their problems. And any challenge to that can be really invalidating for people. But it's my job to tell people the truth. I'm not going to lie to people.
Yeah.
But yeah, it is a challenging field sometimes.
Yeah.
Exactly. I was going to say, actually, like I was saying before, I think the diagnosis, bizarrely, has now ended up being a kind of getting out of jail free card for some people. And they kind of think I am. And if you say to them, no, you're not, they're going to really resent it because they're thinking this diagnosis will make my whole life better.
Yeah, I think it's a search for validation and acceptance. So I think that at the core of it is what it is. And if that's instrumental in how one accepts themselves, if someone comes on and challenges that, of course, that's going to be a really hard experience. I think, though, if I can give people a broader explanation for their difficulties and give them the information as they can, then hopefully they'll see that, they're more than 3 letters, ASD or something like that. But sometimes it can be really overwhelming for people. You know, they've struggled with a lot of things. They come up with other things to answer. They talk to someone like myself. An hour and a half later, they come away with a whole list of things to work on. And it can be really tough because, we don't often have the time or the energy, all the finances sometimes, sadly, to tackle all these things. So it can be an overwhelming experience for people. And sometimes I do try and kind of slow it down a bit and, space it out.
Terry, I'm wondering, like, as people who work with people who have autism, or if we're family members of people with autism or friends, what are some things we can do to kind of support them and make their lives a bit easier?
Yeah, so I guess it depends on the context, isn't it? So obviously if we're employers, if we're colleagues at work, there are lots of things that companies can do to support people who have these autistic traits. And I think being open and having a non-threatening environment and a supportive environment, because disclosing problems like this can be terrifying. Especially if you don't trust other people and the culture of the company isn't very supportive, that can be very difficult. And so what happens then is people get into this sort of stress cycle, and then that kind of compounds the difficulty. So if people can relax and be supported in the preferences of how they work, and it could be, for example, giving them a quiet space or allowing them to have breaks more frequently, or giving them a low stimulus environment, allowing people to work from home once in a while. I think these are really simple things that companies can do, because work is such a big part of our life. And I think there's a lot that can be done in the corporate space to kind of support people who are neurodiverse in many ways. In terms of family, again, it depends, I guess, on, if we're talking about sort of 40 and fabulous, I think it's, spouses obviously can play a big role in this. And hopefully if one spouse is going on a journey of self-exploration and self-understanding, that can only benefit both parties. And so I think we need to encourage our spouses and our loved ones to go on that journey and not feel threatened by it, I think.
You've mentioned before where we heard about this mental health GP program. Can you tell us a bit more about that?
Thanks for asking about that. It's a bit of an initiative that was started here at Mindside. Essentially, when I started the clinic a few years ago, I asked myself, does the world really need another psychiatry clinic? And in some sense, yes.
The answer is yes.
but really what the world needs is more services and more access to good quality care. There are only so many psychiatrists around. There are not many. Spread out between the public sector, the private sector, the corporate sector. It's really spread thin. And so relying on psychiatrists to sort out the mental health problems of the world is just not going to be enough. Yeah. And unfortunately, we're dropping like flies, and burnout rates are through the roof, moral injury, all sorts of things. It's really scary reading. So I thought, well, if I'm going to start something, I might as well start something that's going to hopefully add a bit of a solution rather than just take psychiatrists in other places. And so I thought, a much more abundant resource is the highly skilled GP workforce that we have in Australia that is just underutilized. The GPs train for long periods of time. And many of them are really passionate about mental health, but they just don't have the funding model or the time and the knowledge to be able to do it properly. So how about that? I get some GPs in the practice and we'll train them and support them and allow them to do the work that psychiatrists do, but in a way that's really supportive and which gives the public a really great service. And I'm proud to say that, we now have 4 GPs in our practice that just do mental health care, and their assessments and their management plans, I sort of, look over them and they're good at people are going to find many psychiatrists out there in the community. And so the idea is that people can see the mental health GPs to get earlier treatment, and because a lot of the problems that people face are from waiting. So if they'd have gotten treatment early, a lot of the problems they would have faced would have been sorted out earlier. So, yeah, if anyone's interested in seeing one of our amazing mental health GPs, they just need to jump on our website and contact us. No referrals needed. Just walk in, ring up for an appointment.
What a resourceful psychiatrist.
That's a really interesting initiative. Does this mean that doctors can shave 10 years of study off their degrees?
Well, something's going to change in the landscape of mental health delivery here in Australia. Otherwise, they're all going to go down the tube. So I think there's a place for psychiatrists. I think there's a place for specialist training. But I think there's also a place in the community for the mental health GP as well. I mean, they do extra training. A lot of them have done extra courses and accredited in many different ways. I love our eclectic GP workforce, and I think people should take advantage of it.
If people listening to this, it's raised some questions for us, or, we think we might be on that spectrum, we should call Mindsight Clinic and inundate you with telephone calls. Is that right?
Well, I think a good place to start might be have a chat to your local GP first.
What a good idea.
Right.
Yeah.
The one that's trained to.
One that's trained. Yeah, one hopefully has an interest in mental health issue. And psychologists are often a bit more accessible than psychiatrists. And so a sensible psychologist who, again, has some expertise in the area might be a bit easier to access than seeing a psychiatrist off the bat. There's nothing magical about psychiatrists necessarily. A lot of people come and say, well, I was told by my GP that I had to see you to get a diagnosis. No, not really. I mean, a diagnosis can lead to services and funding, like NDIS. But if it's about self-understanding and trying to figure out, why you struggle, what you do, that's where you have to see a psychiatrist to do that. So.
Yeah, awesome. Well, Terry, thank you so much for joining us on She Wasn't Born Yesterday today.
Yes, thank you, Terry.
It's been very mind-expanding,
It has. It has. It's been very informative, which, as I said, is power.
And very encouraging.
Yes.
Yeah. Thank you so much.
You're welcome. Thanks. It's been a lot of fun. Thanks for having me on.
Gorgo, we hope you enjoyed this episode and we adore that you listen in, but we'd love to hear more from you. What you thought of this ep, what you'd like us to chat about in future, and we'd really like to thank everyone who's got in touch with us so far and suggested ideas and made comments. Thank you, gorgeous people.
So whatever you have to say, search hopepodcasts.com.au and hit the big pink button that says Contact the Team. We'll get back to you.
And remember, if you'd like to send us expensive gifts, just park that Lamborghini in the Hope 103.2 foyer. They won't mind.
Join us next week on She Wasn't Born Yesterday. We really look forward to your company.
Hope 103.2. Thanks for listening.